biggest thing was in the mornings, just getting up, I'd have to look for glasses or contacts before anything else, before even getting dressed, and that was really a hassle. So now I'm really glad that I can just wake up and get dressed in the morning and shower and read and stuff without glasses, and now I can even drive. Before the procedure, my vision was off the charts. The chart only goes up to 20/400, and the first day after the procedure, I was actually better than 20/20. I was close to 20/15 with no glasses. Night and day difference for me. I would highly recommend it.
So Kailey had a very high glasses prescription. She was very nearsighted and had very thick glasses. And we talked about all the options. We talked about LASIK, PRK, and ICL, and we talked about how they all provide excellent vision with equivalent outcomes. But in the laser procedures like LASIK and PRK, we have to remove corneal tissue with the laser, and the higher the prescription, the more tissue you have to remove. So I told her that if she was me or my family member, I thought it was in her best interest to do ICL, which is a procedure that involves no removal of corneal tissue.
I was pretty upset. I'd been considering LASIK for 10 years or so, and then I found out I couldn't get it, and I'm like, well, am I going to be stuck in glasses and contacts forever? Until I heard about ICL. It sounds scary when you read through all the risks and benefits. It's of course easier to just stay with your glasses or contacts, but I was sick of that, and I only qualified for ICL. And since Dr. Davenport was so calm and answered all my questions, I felt pretty secure in getting it done. So after the LASIK evaluation, I had to get an ultrasound of my eye. They had to make sure that the front part of the eye had enough space between the iris and the lens. So they hold your eye open, they put a little cup in it, and then they pour water into it, and then they use a little ultrasound probe instead of using like jelly. It was pretty uncomfortable, but it didn't last long, maybe 5-10 minutes per eye. On the day of surgery, I was pretty anxious, and everyone at the center told me that was normal. Checking in on the day of the procedure was pretty simple, just like going to a regular doctor's appointment. You check in, you give them your insurance, your ID, fill out all the paperwork, and then they take you back into the room and start putting eye drops in.
When a patient comes in for an ICL procedure, they come to our pre-op area, they meet our nurses, they start getting their eye drops, and they get an IV in their arm so that they can get anesthesia during the procedure. And they fill out paperwork, and our nurses answer any questions. And then at some point they meet our anesthesiologist, who comes in and tells them how he's going to keep them comfortable. And then I come in and I talk to the patient, ask them how they're doing, and then kind of coach them and tell them what to expect during the procedure. After their eyes are dilated, we bring them back to the operating room. Their eyes are totally numb during the procedure, so they don't have any pain. They get medicine so they're nice and relaxed, and we usually do the right eye first. I spend a couple minutes loading the lens, and then it only takes about 10 minutes to do the procedure on one eye. And then we take a short break where we take all the instruments out of the room from the first eye and bring in new sterile instruments for the second eye, and then we repeat the procedure. Then the patient goes back to the recovery area. They usually relax, have a soda and a snack, and then an hour later I check on them, make sure everything looks good before they go home.
In between the eyes, there was a little break, so I was able to see around the room, and I felt pretty comfortable. Everything was looking good, and I was ready to just get the other one over with. Staff there was great. That made me feel a lot better. The actual procedure, I was pretty anxious about it beforehand because I knew I'd be awake during it. Once you get into the room, they get you some relaxing medication, and you have numbing drops so you don't feel anything. I don't even remember like the lid speculum or anything being placed. You just kind of look at these 3 lights and just keep looking straight ahead and don't move. It's actually pretty easy with the medications. Looking up, and I could see around the room, and I could see people's faces. Everything was a little hazy, but I was still getting used to the lens, and I was able to at least see around the room.
One of the fun things about ICL is that patients usually sit up from the table and immediately notice improved vision. However, their eyes are still dilated, so they don't get the full benefit immediately, but often they're reading the clock across the room, and they're very excited.
After the second eye was done, we just wheeled back out into the waiting room, and after an hour, had the pressure check to make sure that didn't go up. And he looked at me with the slit lamp, and everything looked good, so I was able to go home.
Their eyes might sting a little bit after the procedure because of the incisions, but that only lasts a couple of hours. And by the next day, their eyes are usually very comfortable and their vision is excellent.
My eyes felt a little dry afterwards, but that's pretty normal after a whole bunch of drops and the procedure. My vision was great though. It was maybe not 20/20, but pretty close, maybe around 20/30-ish. And that it did end up clearing up after a few hours.
I tell patients to go home and relax and take it easy, just kind of have a relaxing day. I ask them to use their eye drops, the antibiotic that prevents infection, and the steroid that prevents inflammation. I ask them to be careful not to rub their eyes and to wear a clear plastic shield over their eyes while they're sleeping to protect their eyes.
After the procedure, I slept great. It was the night before that I didn't sleep so great. I was mostly nervous.
Kailey came back the next day very happy and smiling with better than 20/20 vision. She saw 20/20 on the eye chart and her eyes were comfortable. So Kailey's been doing really excellent, and she's having a normal post-operative course, very typical course for an ICL patient.
They usually say 24 hours after the procedure, you're able to drive. I feel perfectly fine coming back to work. I felt like I could probably come back to work next day, but I took the day after off just to make sure everything was great. Well, it's day 5 after my surgery, and at eye surgeons for my follow-up, and everything seems great. My vision's great. My eyes don't hurt at all.
The 5-day post-op is similar to the first day post-op. We're kind of checking the same parameters, but making sure that things are progressing well, that the patient's happy, that they don't have any concerns, and make sure that they're doing their post-op care properly. So we review the eye drops again and make sure that everything's going well. I would say that the main thing that patients might notice after ICL is more glare when they're driving at nighttime. So when you see oncoming headlights when you're driving at night, they may look more prominent. But for most patients, after about a month, that really subsides or totally goes away. That's usually the main thing that ICL patients tell me is different.
Dr. Davenport said my vision's great and he's really happy for me, and I'm really grateful that he did the procedure.
I would expect her to continue to enjoy great vision for decades, and for her eyes to be comfortable and to not really have any issues.
It's weird not wearing glasses, go and drive and read and do whatever. It's great. If you really want to get out of glasses, then you should do it.
What I would want patients to know about ICL is that it's a great alternative to LASIK and PRK. It provides excellent and equivalent outcomes to LASIK and PRK. Most patients who come in have never heard of ICL, and some of them have been told previously that they can't have LASIK because of their high prescriptions, but it's an easy procedure to go through. It provides excellent outcomes, and I would recommend it to anyone.